Today's is about global exploitation again, but we will talk more about occupational health and safety measures. Um, so, my first uh, comment on this global exploitation logic is going back to Karl Marx and its alienation to understand both its physical and mental illnesses that the workplace can cause on us. Um, so I want you to watch these two short videos first. So it's a good time to stop this lecture and watch these two very, very short explanations of Karl Marx theory on alienation. Some of you got development of sociological theories or classical theory classes, I know, so you probably know what is Karl Marx alienation theory, but I want you to remember what it is, recall what you had in mind, or if you haven't seen so, I want you to go through it. So please stop right now and watch these short videos. I hope you did watch the videos because it is very related what we are going to do today. So the Guardian article and the medical journal article related to those issues of garment industry, clothing work as a matter of global exploitation is going to give you just one example of how occupation or your work or your workplace and environment can affect you, your family, or anyone in this environment in a very, very drastic way. So many workers who toil long hours and attempt to support their families on poverty wages claim they are cheated out of their dues by their employers in those Indian garment work industry. They work for 22 cents an hour for GAP in the Gap, as you know, in Bengaluru in India. One of the garment workers, female worker, explained the situation. Her name is Sakama in the article, in the Guardian article, that it hurts us to be paid so little. I have to do this, and they sell one piece of clothing for more than I get paid in a month. So this is, if you watch the videos carefully, you will get this reference immediately to alienation. What you produce cannot be afforded by you, cannot be part of you in this process. And this is a very, very symptomatic element of exploitation. Another thing the Sakama, the female worker, shared with us in the article is we cannot eat nutritious food, we don't have a good life, we live in pain for the rest of our lives and die in pain. So I would like to think about the first week, what we talk about social determinants of health, what we talk about medicalization, what we talk about more about the intersectionality, and I would like you to think from all these quotes and from the Guardian article of which social determinants of health are at play here. Just in these two sentences of Sakama, to be honest, you can find out many, many different determinants of health playing a role in this healthcare discrimination and inequality. Another worker who works for Gap supplier Modelema Export in Gurgaon gave evidence that he was paid just 5 rupees a month. This is basically 24 cents an hour. Although the legal minimum rate for his job was 5,300 rupees. Rupee is the currency for India. So he also says before a visit, they gather all the workers around and tell them what to say. If you don't say what we are told, we are fired. So you can think of the democratic participation as part of the social determinants of health here. If you don't have a social movement to change the issue, if you can't raise your voice up as a worker, then you can be very much in danger of exploitation and very, very hazardous workplace environments. So I just gave one example, but you can find from these two information that there are other social determinants of health are at play here. I would like you to think about it and write on your comments. And as a reference to social movements, there's one social movement that has been recalled in the Guardian article, the Asia Floor Wage Alliance. In the United States, there are a lot of them called there are actually Students Against Sweatshops who are working against this exploitation all around the world at Rutgers. There are also, and this is not only limited to Rutgers, it is going on in many other places. There are like living wage campaigns in New Jersey and all around the nation in the United States, and in many other countries as well. So we can think of other wage and better pay organizations or equal pay organizations when you think of the male-female gap for the same work in wages. So gap in wages for their work. So Ananya Bhattacharjee, sorry for my pronunciation, international coordinator for the Asia Floor Wage Alliance, told the tribunal that despite the recession, the garment industry continued to bring in profits, so they had to continue having garment industry in India because it brings profits. She said workers continue to suffer shocking inhuman conditions and were being paid poverty wages. Nothing can be more important than a decent living wage for workers working day and night to clothe the world. So if you think about it, although the relationship between the economic growth and poverty, as we were talking in the last lecture, and in the previous ones as well, actually, the economic growth does not bring um, health, like a better health status for people. Sometimes it brings even worse because for economic growth, which is bringing in profits to the country, um, you can um, you can exclude certain populations from healthcare by privatizing healthcare, or you can basically ignore all the regulations about health and safety measures for occupational health and make them work day and night, treat them as dehumanized beings, calling them donkeys. All it's horrible if you read the article. It's not only the structural violence, as Paul Farmer said before, if you remember the first lectures, um, is uh, uh, is taking place at many different layers. One of them is the dehumanization of these workers. The other one is more like the occupational health and safety measures that they deregulate, the government deregulate to allow the companies to maximize their profits and reduce their costs by giving so little to workers. And even when you think about it's not only about the wage that they give, it's also the safety and health and safety measures that they didn't provide for those workers. Providing those issues like giving helmets or like letting them work less hours are going to be costly for the profit maximizing companies. And when you think of Gap, even probably this is from Gap, that or H&M or Walmart and all these textile industry that we use in the first world or in other parts of the world, that you can see this is coming from long hours of work, a lot of discrimination in the global south. So just think about it as an ethical consumer to consume those brands. Anyway, I would like to ask you if you know any social movements or organization who fought for living wage or better pay. Um, Fast food workers are very much on the news these days in the United States. So you can talk about Fight 15, and they are fighting for $15 an hour, while we were talking about 24 cents an hour in these countries. And I would like you to think about the global hierarchies between those countries as well. Um, if we go to the details of what are the issues, occupational health status of women and men in the garment industry in India, we will come to the study. And first, let's go through the demographics. According to World Health Organization, over 1,000 million people worldwide are employed in small-scale industries. The garment industry of India is one such industry. It is a small-scale one. It is an unorganized sector, mostly run by private establishments. It provides employment for both men and women, mainly those from the lower socioeconomic status classes. Studies show that the musculoskeletal problems, diseases of the respiratory system and eye, accidents, injuries, skin diseases, stress, insomnia, etc., are all common among these workers. The ill health is compounded by various socioeconomic factors such as poverty, lack of education, poor working conditions, excess working hours, and poor diet. You can see all these social determinants of health that the Sakama was talking about, and in other examples that we will see today. Some of you gave a lot of importance to the education, and it pops up here again. I would like you to think about how education affects healthcare and health status of people in general, because we talk about economic growth, poverty, income a lot. Now we have to talk about the working conditions, the excessive hours of working, the environment that they're working, and the poor diet because of lack of income. I would like you to think about how education plays over these, or if education is as important as the working conditions or excessive hours, so we can talk about it more. Um, so what is the disorder that I couldn't even pronounce? Musculoskeletal disorders. These are work-related upper limb musculoskeletal disorders. So these are different kinds. It comes from here until here, and it can also affect your back a lot and the waist, and even hip. To be honest, I might have a musculoskeletal disorder in a way that we always sit on the same place for hours and hours without stopping to write an article as academics. This is more about sewing and embroidering. You have to do this move all the time, and if you can't do anything else for hours and hours, if they don't let you go, give breaks, then you actually suffer from a lot of muscular diseases. And this gives you a list of them. It can be many of differences, and if you want to check one or two of them what they are, please go for it. Um, so you will understand how our body is actually very, very material, and the way we use it within the labor force is actually affecting um, how we have a better healthcare or not. Giving breaks are very important, even for yourselves while watching these videos and doing work for the university on the computer. Try to give breaks every 45 minutes. It will radically improve your life expectancy, to be honest, because of all these muscular diseases. Um, the other thing that I would like to go through is the research design they do. I'm hoping that you have already read. I'm just going through them just to make emphasis. They made a community-based cross-sectional study carried out in a slum area of Calcutta in India. And the garment workers were interviewed using a pre-designed, pre-tested, semi-structured questionnaire that had been translated into the local language. The questionnaire collected data on socioeconomic conditions, occupational history, health problems, and they think it is not enough because questionnaire can be misleading. So they did also focus group discussions with 9 workers participating in one discussion about their problems and health issues and complaints about the occupational health. Um, if you have any questions about the study and its research design, please ask me, or please discuss in the comments, because one of the things that you would do if you became a policymaker, or if you will be engaged in any part of the health policies, you have to be evaluating, and you have to be researching on people's health and the reasons that leads to ill health, or the reasons that leads to better health, and you have to design research. I hope you all get introduction to research methods from sociology or any other discipline in social sciences. You will see how they see what's going on among the garment industry workers in India. Um, and they will that's a tedious study they do, and to find out what are really the issues in terms of ill health, what can cause it and what doesn't cause it in many ways. Another thing is like making questionnaire and interviews are important, but making a group discussion, a focus group, also will give you other information about what's going on in group dynamics. Sometimes workers they tell much more among their friends. Sometimes they tell much little. So there are a lot of things going on in those resource designs, especially since their jobs are on the line. When you are very much threatened by these companies, and if you are indispensable, you're actually dispensable worker, like unskilled worker, for the labor market in those countries, then it's very difficult to talk about those things to any researcher or any journalist, or complain about it. You just continue working in whatever situation, whatever health problem it creates for you. So think about all these issues in the research designs that you may be coming up with your own project as well. So what did I find? Go through the table, and you can see how uh, and which variables are connected to each other, which are statistically significant, which are not. So the results in words are the average monthly per capita income was 500 to 1,000 rupees. Please check the rupee in terms of dollars. You will see um, how discrepancy is there in terms of currency, and this is part of the reality of the global economy. You can't change it, to be honest. The other result is most of the workers were males, 76%, and were in the 15 to 45 age group, well, with none below 14 years of age. This is probably not true. They just don't register the, the child workers, to be honest, in anywhere, not only in India. Um, Also, addiction was rampant. That's more than two-thirds of the workers were addicted to one or more substances, including tobacco, alcohol, or both. 23% of the workers were illiterate. Most of them belonged to poor socioeconomic status. And when we come to the health problem, the musculoskeletal problems, this is the most common health problem. The body areas commonly affected was neck, low back, and hand, wrist, fingers, and shoulder. The common symptoms in these subjects were pain, weakness, stiffness of the affected parts. Um, of course, these are like extreme stiffness, extreme weakness. So these are the ones that they got from the tables, the statistics, and the age is one of the important dynamics as well. Let's look at age. See, there's the more they got into these 90, wait, it's if it is more than 45, then you have more. Out of 20, you have 17 of them are having musculoskeletal problems present. So when they do the focus group, they found out other things. One of them is most of the workers were Muslims who had migrated from their rural ancestral homes in Bihar to this urban slum, which is the largest slum in Kolkata. They worked with labor contractors and were paid according to the number of finished goods. There was no fixed remuneration, and when they fell sick, they lost precious hours of work and therefore money. On the other hand, many workers took on extra work so that they could earn more money, even if the heavy workload was detrimental to their health. They also found out the workers complained of low wages, long working hours, no relaxation time, and lack of cooperation of the employer because they were never allowed to go on leave, even when they were sick, and no financial help was given, even if there was an emergency in the family. So they were also very satisfied with the healthcare service, although it is covering everyone in United States, in India, sorry, was available to cater to their health needs. So it wasn't convenient enough for thinking of their working hours and health status. When we go back to the results of the relationship between their work and then musculoskeletal morbidity, I went through the older age, so it is more common in the older ones than the younger ones. Um, and in females as compared to males, in illiterate workers as compared to those who were literate, and in substance abusers as compared to those who had no history of substance abuse. And you can see the percentage here. But these are not statistically significant, so these may or may not be the case. The ones that are statistically significant are the working hours, number of years that they work. So the people who worked more than 10 years in the same job, they got much more musculoskeletal disorders than the other ones who worked less than 10 years in the same and a similar job. The ones who worked for longer hours, which is 10 hours, more than 10 hours a day, they have more musculoskeletal disorders. And in those who were engaged in cutting and sewing, which is this job, rather than compared to other jobs in this factories, are affected more by more related to musculoskeletal disorders. So all these are statistically significant. So the actual work on your body has much more influence than the age, the gender, the literacy, and the substance abuse when you think of musculoskeletal disorders among garment workers. So, in the discussion section, the authors discuss the work environment exposes many workers to health hazards that may result in injuries, respiratory diseases, cancers, musculoskeletal disorders, reproductive disorders, cardiovascular disorders, mental and neurological illnesses, eye damage and hearing loss, as well as communicable diseases. So, when you think of our workplaces, we actually spend so much time on our workplaces where it is very important. If you do uranium mining, which we will see afterwards, then you will have a issue with your health because it's on your environment all the time. If you work with radiator, nuclear radiator, then you should be careful about the cancer. There are a lot of things. If you work in a mine, coal mine, then you have to be careful about the incidents that happens. They call it accidents, but it's all because the companies, the mining companies, didn't get health and safety measures right, and the state didn't regulate it as much. They didn't send anyone to check the health and safety conditions of mine workers, and all these disasters happen in many places, as we will see. One of them happened very recently in Turkey, in Soma, very close to Izmir, one of the biggest cities of Turkey, and 301 miners died. And it's very common in resource generating places with a lot of raw materials like mines, uranium, coal, or whatever energy the country is producing. And it is not also a third world issue, it is actually a first world issue as well. Similar findings were reported by the Canadian Women's Health Network, with musculoskeletal disorders being the most common hazard in women engaged in sewing. And stress at work is a growing problem for all workers, especially women. According to European Foundation's 1996 European Union-wide survey, women are more likely to have difficulty in taking breaks, days off, or holidays. It is also because of pregnancy issues and etc. The employers were harsh on women. So think about the intersectionality again, as I was referring to, not only about gender class, but also global hierarchies in different countries, living wages in different places, and how it is outsourced to the global south from global north um, in terms of international trade. Um, so now we came to one of those issues that I was referring. There's the please watch the Soma mine massacre in Turkey first. They call it massacre because it's the fault of the companies and the government who didn't take the safety measures for the mine workers until the accident, quote unquote, happened. It is very short. It's kind of mm, it's it's heartbreaking in many ways. All these people in a small town are suffering, and their families are suffering from the same issues. This is a death. This is basically it's about life and death issues. When we look at the Navajo Nation in Arizona in the United States, and they're mining coal mining issues by Vice News video. We'll watch that video as well. So we will talk about how the environment got affected by their workplace, and the workers in that environment are very much the target of those healthcare issues and inequalities. I hope you watched the documentaries, the brief news about these two issues. It is to draw attention to the mining as a very important work and employment for generations and generations in many different places, who has a lot of resources. So, who is the Great Navajo Nation? If you haven't heard before, please check it. The link, I put the link of Wikipedia here, so you can click it. These are their flags and the seals of Navajo Nation. They live around in between Utah and Arizona, and next in Mexico and Colorado. It's over here. They are one of the biggest tribes, the indigenous population that lives here in the United States, even before the migration from Europe happened, and they stay still. So please check their history to understand what's going on in terms of um, race and class dynamics, who are forced to do which kind of employment in United States or in many other countries. To be honest, it's not only United States. So one of the issues that you will see from those videos, that Navajo Nation is not only suffering from coal mining but also uranium mining. They have a lot of resources under their earth, and when they first were employed by the state and then companies to do mining in the uh, around the early 20th century. um, they were first grateful because they were earning money through these employments. But the more they get into, as you see in the documentary very well, the more people started to suffer from lung cancer, respiratory diseases, and issues related to communicable diseases. The 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 federal government deliberately avoided dealing with a health disaster among Navajo uranium miners, even though uranium mining was considered very much of a federal matter, and everyone knew that after the 1930s that there was no scientific doubt that uranium mining was associated with high rates of lung cancer, but they didn't take any measures about this, and they make the Navajo Nation people work for it, no one else. So it became a certain population's issue, a minority issue. For up to 2 decades after the harmful effects of uranium mining were known, protective safeguards were not implemented. Still, you may ask, what are the protective safeguards? Maybe they do not exist. But if they do not exist, then they have to think about um, which kind of measures, which kind of like limitations to this labors, and which kind of salaries that do they receive, because they actually put their healthcare into danger, should be discussed, and these are not discussed at all. in general. But mostly, and for first and foremost, we should discuss the safeguards, the protective measures that people could benefit. It can be costly, but people's lives are worth paying money for safeguards by the companies who make so much money out of those mining. This is the end of the class. It is these are all heavy issues. So in while watching documentaries, I had to stop a couple of times to think about what people go through. And I don't want you only sympathize or empathize with those people. I want you to think of structural violence, structural elements, which are affecting certain populations in different places in the world, and think about all these intersections between those gender, class, race, sexuality issues, and how occupational health matters for people. Um, there are there are different layers of inequality here, um, and when you see certain populations are targeted for certain jobs because they live in such and such place, and their lives are seen more disposable by the elites or by the hegemonic ruling class, then you see how uh, it is such an unfair world. But I would like you to think about also there are a lot of people like the grandmother in the Navajo Nation that still fights against all those inequalities. That gives you hopefully some hope. Hopefully some hope. And I hope you will discuss and find out other social movements which will better people's health status all around the world, so we can discuss about these and be more hopeful about certain situations related to healthcare inequalities. Thank you so much for listening.